Today we will talk about speech disorder in these cases of the nervous system. The first aphasia, dysarthria, and anarthria. Speech disorder is a condition in which a person has problems creating or forming the speech sound needed to communicate with others. Some disorder for the first one, articulation disorder, the second, phonological disorder, the third, dysfluency, the fourth, voice or resonance disorders. Aphasia is an impairment of language affecting the production or comprehension of speech and the ability to read or write. Aphasia is always due to injury to the brain, most commonly from a stroke, particularly in older individuals, but brain injury resulting in aphasia may also arise from head trauma, from brain tumors, or from infection. This is Broca's area in Broca's area involves production of speech sound. The second awareness area involved in understanding of speech. This area. The third motor cortex controls the movement of muscles, and articulate fasciculitis connects awareness area to Broca area. Types of aphasia, for six types of aphasia. The first one, global aphasia, is the most severe type of aphasia. It's caused by injuries to multiple parts of the brain that are responsible for processing language. A patient with global aphasia can only produce a few recognizable words. They can understand very little or no spoken language. The second, Broca's aphasia, also called non-fluent or expressive aphasia. Patient with Broca's aphasia have partial loss or their language ability. They have difficulty speaking fluently, and their speech may be limited to a few words at a time. The third one, mixed non-fluent aphasia. Patient with this type of aphasia have limited and irregular speech. They may be able to read and write, but not beyond an elementary school level. Broca's aphasia damage to motor, image, language comprehension skills relatively preserved, typically observed in patients with damage to the left inferior prefrontal cortex. The fourth one, Wernicke's aphasia, is referred to as fluent because while these individuals have an impaired ability to compress the spoken words, they don't have difficulty producing connected speech. The fifth, anomic aphasia, a person who suffers from anomic aphasia is unable to come up with the right words for what they want to talk about. They have a grasp on grammars and speech output, but they simply cannot find the words to discuss what they want to. The sixth one, called PPA, primary progressive aphasia. PPA is a neurological syndrome in which someone loses their ability to use language slowly and progressively, while most other forms of aphasia are caused by stroke, and also primary progressive aphasia caused by neurodegenerative disease like Alzheimer's disease. Symptoms of aphasia: trouble speaking clearly, trouble understanding speech, trouble writing clearly, trouble understanding writing words, trouble remembering words, trouble remembering object names. The second type of speech disorder, dysarthria. Dysarthria is the defective articulation of sounds or words of neurological origin. Language function are normal. Proper syntax, pronunciation is faulty. Breakdown in performing the coordinated muscular movement necessary for speech production. A good general rules that no matter how garbled the speech, if the patient is speaking in correct sentence, using grammar and vocabulary commensurate with his dialect and education, he has dysarthria and not aphasia. Characteristic of dysarthria subtype and characteristic. The first one, flaccid dysarthria, speech may should nasal or slurred. The second one is spastic dysarthria. Speech may sound as if patient is squeezing out words from a parched mouth. The third, ataxic dysarthria. Speech is uncoordinated range, timing and direction may be inaccurate, rate is slow, may be explosive in quality. The fourth one, hypokinetic dysarthria, speech may sound monotonous or slow, based rate may vary regularly and may be present. The fifth one, hypokinetic, involuntary disruption in sound and or movement. Dysarthria sign and symptoms, inability to speak louder than whisper or to speak loudly, abnormal speech rhythm, strained raspy or nasal sounding voice, monotonous speech, uneven speech volume and or slurred speech, rapid speech that is difficult to understand, difficulty in moving the facial muscles or the tongue. That's all. Thank you.
Ziad,